This video is about how to perform intravenous cannulation. As with all the procedures, you have to start by introducing yourself to the patient and confirming the patient's details with the BHT. You have to explain again the procedure to the patient and obtain their consent. You need to have gone to the patient having gathered the necessary equipment. As usual, you need non-sterile gloves and tourniquet, the kidney tray with cotton swabs and gauze. Also, you need to have alcohol to perform asepsis, and you need some elastoplaster and the scissor. You need a 3 cc syringe with its needle and normal saline. You need to find the appropriate gauge IV cannulae depending on the purpose of the cannulation, and a marker pen. You need to ensure that the sharp bin is also there. You need to wash your hands and put on the gloves and position the patient's arm and support it with a pillow if needed. You need to identify a suitable vein, and for that you need to apply the tourniquet and ask the patient to make a fist and palpate to locate the vein. Ideally, for an IV cannulation, the vein should be of large diameter with minimal mobility and a good turgor. Tap on the identified and located vein to distend the vein. Usually, for IV cannulation, the chosen sites are the veins of the dorsum of the hand, cephalic vein, basilic vein, and antecubital fossa vein. It is best to insert a cannula to the non-dominant hand and on the forearm when possible. Therefore, ask the patient if there is a preferable site to insert an IV cannula because the patient has to keep it for some time. Specifically about antecubital veins, they might extravasate with flexion of the elbow, and the veins of the dorsum of the hand are more prone to clot also. As with phlebotomy, if there is infected or edematous or burnt skin, or there's an arm with an AV fistula or a limb affected with stroke or DVT, it's better not to choose that arm or the limb to cannulate. You need to put on non-sterile gloves and clean the area with alcohol on a cotton swab. Prepare the cannula for insertion by opening the wings, checking that the top cap and slightly withdrawing and replacing the needle. Hold the cannula with your dominant hand and secure the vein with the non-dominant hand. Ask the patient to make a fist if the chosen area is an arm. Insert the needle of the cannula into the vein by pricking at an angle of 20 to 40 degrees as with phlebotomy, with the bevel facing upwards. Look for the flashback, and if it is there, advance the needle a few millimeters further. Withdraw the needle a bit and advance the cannula fully into the vein. Release the tourniquet and ask the patient to release the fist. Press the tip of the needle over the skin and retract the needle and discard it. Replace the cap and secure the cannula with a plaster. Put a gauze piece underneath the cannula and flush the cannula with 2 cc of normal saline to confirm correct placement of the cannula. You need to remove the gauze and secure the cannula with another plaster and mark the date and time of insertion of the plaster to ensure timely removal. Then you need to thank the patient and take your equipment and dispose of them appropriately.